Welcome everyone. Today I gonna discuss about World Health Organization defined health system and their function. Segment and fragmentations measure system intelligence, model of care and organizational model and definition. This is the Babel Towers, source, sugars, jokers, accords and many things. Health system all the institutions, people and active whose primary purpose is to improve health. Improve people health and well-being, responding to the people expectation, providing protecting against the cost of ill health. Health system all the institution, people and action whose primary people is to improve health. Health system service delivery, generation of resources, governance and financing. Health system health service, healthcare provisions or delivery of a care is only one of the health system function. Health service are the set of institutions and programs that provide direct care to the health and disease need to individuals and public health services for the protections of collective health. Major system challenge segmentation, fragmentation. What is the segmentations? The coexistence of substances with different modalities of the financing, affiliations, and healthcare delivery, each of them specialized in different start of the population according to the type of employment, income level, ability to play, and social status. Major system challenge. Fragmentation of the health service is related to the coexistence of the service unit or facilities that are not integrated into a single networks or service at different level of care that are not coordinate among themselves. Of care defined healthcare delivery that does not cover the entire range of promotion, preventions, care, rehabilitations, and uh, palliates care service and or service that do not continue over time. Major system challenge advertising segment, fragmentations of the care, new model of the care, fragmentation of the service, new ways of organizations and managing healthcare delivery, such ISS, IHSDNS. Universal access to health and university coverage, universal access, absence of the geographical, economical, social, cultural, organizational, and gender barriers that prevent all people from making equitable use of comprehensive health service. Universal coverage, sufficient organization mechanism and financing to cover the entire population. Four simulations and independent strategies. Equity, equitable access to the health service, increase financing with equity and efficiency, strengthening intersectorals, coordinate to SDAs, strategy, stewardship, and governance. Expanding equitable access to comprehensive quality people and community created health service, new models of the care, new models of organizations, and new ways and capabilities for managing healthcare delivery service, comprehensive and progressively expanded health services, increase investments in the first level of care, improve and increase the responsibility capacity of the first level of care in IHSD and identify to unmet and differentiate health need to of the population, improve human resource capacity in the first level of care, essential medicine and technology empowerment of the people and communities. Expanding equitable access to comprehensive quality and the people community centric health service. New models of the cares, new models of the organizations, and the new and capabilities for managing healthcare delivery services. Comprehensive and progressive expanded health services increase investment in the first level of the care. Improvement and increase the response capacity of the first level of a care in IHSD and S. Identify the unmet and differentiate health needs of the population as well as the specific need of the group in the situations of vulnerability. Improve human resource capacity in the first level of care. Essential medicine and technologies empowerment of people and communities. Universal access to comprehensive quality and progressive expanded healthcare. The model care should be coherent with the strategy's vision for the health and well-being. The redefines of the model of care constitution a care decision movement in moving towards universal access to health and universal health coverage. The new model of the care will require new organizational arrangement in order to be effective, efficient, and quality oriented. Universal access to comprehensive and quality and progressive expansion health services. The model of care must be strategic defined in the order to optimize health outcome. The model of organization and management of the healthcare services must be addressed from a systematic perspective and let not forget the determinant of health, because it really does not make much sense to provide excellent care in clinic and hospital if people are to return to the candidate that made them ill in the first place. Model of care, a logical framework that defines what services will be provided to address the health need, demand, and experience of the population. Organizational model, the structure, organization, research, requirement for delivery of the service in response to those needs, demand, and expectations. Model care and versus health organization, governance and stewardship, financing, resource financing, model of care, organizations and management, service and benefit. Transition model of care, values, focus, governance, finance, provision of services, development of the resources, system approach. Biomedical model of care, centered on accurate episode care, supply driven, hospital based, provision of creative service, lack of continuity, inefficiency, referral system, general of exclusive and dissatisfactions. The biomedical model of care and the radar phenomena. The patients in treated, the patients in discharge, the patient vanished. People-centric model of care, people-centric, integrated, comprehensive, continuous, life cross. Organizational model, the structure, organization, and research required for delivering for service in response to those needs, demand, and expectations. Fragmentation of healthcare delivery and care. Healthcare, what pushes the needs to change. Integrated health service delivery network, defined as a network of organizations that provide or make arrangement to provide equitable, comprehensive, integrated, continuous health service to a defined population, as will be to health accountable for its clinical and economical outcome and the health status of the population served. Integrated Health Service Delivery Network organization attributes of the model of care ISHSDNS, people and community centric, responsibility for an assigned population, a network for facility, multidisciplinary, delivered to of ambulatory special services, mechanism to coordinate care throughout the continuum. More definition, the importance of synthesis, Babel towers, primary healthcare versus primary care. A PHL based healthcare is an overreaching approach to the organization and operation. PHS is a strategic approach to the develop, organize, manage, and financing of health. We utilize first level of care to refer to the base level of organizations. Major system challenges of health services or care definition. Integrated care and integrated services. Integrated service are the organization structure and research involved in facility integration process. Integrated care result when the communications of this process directly benefit communities, parties, or service users. Integrated care is an approach of the people and communities. Integrated care should not be solely regarded as a response to managing medical problem. Integrated care is the most efficient when it is popular based. The life cycle versus the life cycles, health, disease, and social care. Continuity of the care. Continuity of the care is a degree to which a series of discrete events in healthcare are experienced by pros and cons. Continuity of the care, sharing essential information for healthcare delivery, integrated care across level and institutional boundary, regular access to different point of care in the network. Instrument, evidence-based medicine, electronic health record, referral mechanism, innovations in service delivery, medications. Who are the healthcare manager? Healthcare manager, all persons of the health should managers resources and is so doing are responsible for making decisions. Healthcare or the health service manager. Strengthen the management of the healthcare delivery. Health service, particular hospital are most complex organized to manage. Majority of the hospital manager are physician. Health system formal suffer from lack of managers, insufficient numbers, poor functions, lack of enable working environment. Gatekeeper and first point of access, hospital, health system performance, health system reform. Common goods, the improvement of the health conditions of the populations to promote equity in health condition, access and coverage, to improve quality of care from the technical standpoints and the user perspective, to increase the efficiency of the health financing, to ensure sustainability, to promote social participation in planning. There is no single best practice for HSR, but in order to contribute to improvement in the population health. Key takeaway idea. Semantic method, there is a difference between integrations of several and integrations care, integration service delivery, integrate care, and integrated healthcare implementations. This is all about the today's discussions. If you have any kind of questions regarding healthcare system and healthcare policy, you can communicate with us. Thank you.